very important part of getting the facts out to the public about the coronavirus, but also about just basic good healthcare policy when it comes to any time of the year, but especially during flu season. As you know, I'm the Republican leader of the Energy and Commerce Committee. I only tell you that because our committee actually has the jurisdiction over the Center for Disease Control, National Institutes of Health, all the folks you've been seeing on TV explaining what's going on. As fate would have it, find their overseer to be our committee. So we've spent a lot of time on this. I was in the Situation Room at the White House about 3 weeks ago with many of these same players as we've all looked at what was happening overseas and talked about what are the plans to deal with it here. You should know that a couple of years ago we actually passed into law legislation called the Pandemic All Hazard Preparedness Act. This set up the framework for how to deal with pandemics. This is not new. It's something we've worked on and in a bipartisan way for many years. We also passed legislation that brings funds to our local communities through the public health care system. And thank goodness we do, because I'm joined here by not only representatives of the Jackson, Josephine counties, but also of their health departments. And when you get a situation like this, we rely first and foremost on our local public health service providers, both in the private and the public side. They're the first line of help for our citizens. And so the reason we had the roundtable today was to make sure I had the information necessary to talk about what needs to be done going forward. If they need other assistance, we'll get it for them. I was on the phone this morning with Pat Allen, who is the head of the Oregon Health Administration Authority, the Oregon Health Authority. As you know, we have one case that's been identified in Oregon, in the up around Portland in the Forest Grove area. And so he filled me in on that situation. I believe there are now 4 cases in Washington State, including 3 cases in Washington State, and one person has died there of the coronavirus. I think it's important for people to understand the best thing you can do is basic good public health. Wash your hands, get a flu shot, use these things that I never like to use that smell funny, but you know, these hand sanitizers, they make a big difference. And if you're feeling ill with a flu-like symptom, consult with your local healthcare provider first and foremost. But keep in mind that already in America, 14,000 people have died of the seasonal flu. And many, many, many people have not gotten a flu shot yet, and you still could. And so coronavirus is serious. It's a new one. At the national level, the Centers for Disease Control and the FDA are working hand in hand to make sure that we have tests available throughout the country to ascertain whether or not somebody has this disease. Today, they announced new directives to make more tests and new tests available in record time. When it comes to a vaccine, Dr. Fauci has made it clear from NIH that if everything goes at light speed and with no problems, it could be 12 to 14 months before we have a vaccine that will work for this disease. And that is with remarkable technology and incredibly smart scientists working on it, and with the effort of the Chinese to make the genome sequencing available online, which they did. So there's work being done to develop a vaccine. It is slated to go into trials soon, but that can take upwards of a year or more. In the meantime, we don't have a direct medication to deal with this virus specifically, although they are working on repurposing some drugs that can, they hope, provide a relief. So now you're back to basic health care, which I would argue nobody does better than we do here in the U.S. I want to also make clear that we have developed a page on our website at walden.house.gov/coronavirus, where we have the latest links and information from the CDC, the Oregon Health Authority, and other agencies, and what they recommend. As you know, this virus and how we deal with it changes as it spreads. The virus itself doesn't necessarily change. They've not seen it mutate yet. But how we deal with it now that it's in multiple countries changes. I would say we are prepared in America. This is something we have planned for. There are very, 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 very few cases And so we just need to be vigilant, we need to be thoughtful, and go about our lives. Anybody else want to weigh in from the?
Sure, I could.
Perfect.
Have a few words. So as the Congressman mentioned, the situation is changing rapidly, and we're closely monitoring that from CDC and Oregon Health Authority. By the way, my name is Jackson Bowers. I'm the Jackson County Public Health Division Manager. Currently, there are no cases in Jackson County. We're monitoring people that may have been exposed to COVID-19, known as people or persons under monitoring, and we continue to collaborate with the Oregon Health Authority, local EMS, and healthcare providers to ensure effective and safe response should someone under monitoring develop symptoms. Importantly, CDC has developed guidance for communities, schools, daycares, businesses, and others. This guidance is available on their website, and we encourage everyone to review it and get prepared. Importantly, again, to reiterate what the Congressman said, people can take action to help prevent from getting COVID-19, influenza, or any other illness. And that's practice good hand hygiene, washing your hands, cover your coughs and sneezes, stay home when you're sick, routinely clean frequently touched surfaces and objects, and importantly, stay informed. Monitor the Center for Disease Control and Oregon Health Authority websites for updated and accurate information. Review the preparedness guidance on those websites. For general information, people can also call 211. If you are well, it's important that you don't wear face masks. This has been a rumor that's been going around, and they're not recommended. The only time general face masks, and those would be surgical face masks, are recommended for people is if they're sick and they need to go out, such as an appointment to their medical provider. So please don't do that. Leave those supplies for the medical community because they are in short supply at this point. Now, Jackson County Public Health has experienced many other emerging infections such as Ebola, Zika, and H1N1. Should this situation worsen and this become a pandemic, or we have a local outbreak, the response will likely be very similar to H1N1, and that would likely involve social distancing. That's limiting face-to-face contact with others, possibly delaying or canceling public events and mass gathering, and implementing alternative work practices where possible, like teleworking. What I'm really trying to get at is there are solutions and preventive actions that we can take to prevent COVID-19, influenza, and other illnesses. So, thank you.
Thank you. Anybody else? If not, questions?
So right now we know there's one presumptive case, still waiting confirmation from CDC. Yeah. Has there been any word from the CDC though that it's finally been confirmed?
Not that I am aware of. Okay. I think the OHA would announce that.
Okay. So. And it sounds like there was another case that they're looking into. They're waiting for testing on that from last night's press conference with OHA. We said down here, Jackson County, Josephine County, no cases. Any other counties
no
that we're
cases
aware
here,
of?
right?
Monitoring?
I think the only ones in Oregon are the ones you've identified. And those are monitored and not confirmed. The presumptive one, yes. The other one, they're waiting for results.
What concerns are there with the death that we've just received news about in Washington State?
I don't know all the specifics of that, but we do know with the coronavirus, at least so far, 80% of people who contract it have sort of mild, I will say, symptoms. Of the other 20%, it has a death rate of somewhere in the 2 to 4% range, but we're not 100% convinced that's the right number, because in China, we think that they have been counting the ones that come in that are really serious and in their hospitals. We would assume there are many more that are not in that count. I can tell you that as of a little while ago, they confirmed 79,251 cases and confirmed deaths of 2,835. And they've discharged 39,002 people in China. In the U.S., we, as of just a few minutes ago, have 66 confirmed cases. 19 of those have been infected from either traveling or person-to-person spread. And 47 were repatriated to the U.S. and are infected with the virus, including 44 from that Diamond Princess. So we're still in pretty good shape here, if you think about it, compared to the seasonal flu. So we're watching it carefully.
What should people be aware of in terms of besides symptoms, before they start showing symptoms, are people carriers for a certain amount of time?
Yeah.
Do they know? Or what
Yeah,
is the
this
details
is,
on that?
you know, we're learning more and more every day about this disease. And there does appear to be evidence that you can be a carrier and have no symptoms. This is something they're evaluating carefully, and that's why getting these tests out is a good thing. At least those who have symptoms, we can test more. As I said, the CDC and FDA approved additional tests, and by the end of next week, every one of these labs around the country that's certified should now have the tests available for them to conduct. And they're rapidly producing more. Remember, we didn't have a disease a couple of months ago, let alone a test for a disease. So our scientists have been working overtime to get this done. And now they had to prove them, and they had a little problem with one of the reagents. So they don't need that third reagent in the test, they don't think. So now others are looking at new tests, and the government's cleared the way for those, having met certain standards, to now be available as well. So everybody's trying to ramp up so we can test more. That will help in that situation. I don't know from a public health, if you're not feeling sick though, I don't know how you know whether you're carrying the virus. This gets back to good public health. Wash your hands, you know, use the hand sanitizer, and use all those precautions. And by the way, that will help against the standard flu or the standard cold. It's things we all should be doing anyway.
Can we be looking at even tighter screenings at airports as this escalates further?
If need be, yes. And as you know, they upped some of the travel restrictions today. And I think you'll see that's an international effort as well as a domestic effort. It is an appropriate effort. And so I think that we will be flexible on this and do what needs to be done. Congress will be as well. I don't think you'll see any fight over whatever the agencies say they need in terms of money they will get. The president's indicate he'll sign. We're talking about where that comes from, how much it is, what do you really need, what can we go procure. There are issues with some shortages with face masks and other things, because frankly they're not made here, and they're made in mostly in China, and they've really used them because they have so many more people affected. And so that's to the point he made, you know, leave the professional gear for the medical professionals. We need to keep them healthy, especially if there's some outbreak. They'll need access to that. We do have in the state of Oregon and across the country stockpiles of medical devices and medicines for this and other types of health emergencies that can be moved as needed when needed.
And what might this mean for local hospitals and emergency rooms here?
Well, you know, this is the time of year where you have a lot of flu cases coming in to begin with. So, you know, they're working regularly to deal with existing health issues. And that's why it gets back to, if you're feeling ill, don't just necessarily rush to the emergency room. Talk with your medical provider. Let's not overload the emergency rooms. We have a fantastic health system in Oregon. And talk to your provider first, get their counsel, stay home. Now, if you're in some sort of severe status, absolutely go get emergency care. But prior to that, talk with your local healthcare provider. Try not to circulate in the community, and I think that's probably the best counsel, right? In terms of.
I agree.
From details that we've garnered so far in China on who's affected, is there a certain population that should be more wary about this than others, say elderly, children, people with pre-existing conditions?
I think again, we see in these outbreaks that elderly and people with compromised health care systems, their bodies, they've got issues. They're probably the most vulnerable. Sometimes young children are very vulnerable in this. And yet I know in Southern Oregon, I think this is actually, we've lost 2 fairly young people to seasonal flu this year. I think one in middle school and one in a high school. So, you know, the flu can be a tough virus. This one is new to us, and we are still trying to figure out what it will do. It seems to have a higher fatality rate than the common flu, and the common flu is pretty tough. But it usually is in the 0.1% fatality rate. This one appears to be in somewhere around 2 to 4%. But we'll learn a lot, and there'll be a lot more data coming in. So
Can you tell me a little bit about the roundtable today, some of the takeaways maybe that,
Yeah,
concerns that were brought up?
Yeah, it was very helpful, and I especially appreciate them coming in on a Saturday, and the commissioners as well. So a couple of things. One, improving the flow of communication from CDC. If we can get a direct pipeline to our local community healthcare providers, that would help. Obviously, CDC posts things on the website, and they announce things publicly. And with all due respect to my friends in the media, but they'd like to hear about it before they read about it. And so that would just help because they get calls. I don't think anybody's trying to hide the ball here. It's just, okay, what's working, what's not. And so we'll go back and talk to the CDC to see if there's a way to speed that delivery of information so that they're not caught unaware. I think that's part of it. And then I think probably the other things, just improving access to the testing. Yeah, now again, they're producing the tests, they're getting them out, but clearly that's something that would help going forward. It's not an impediment now, but as we look at what happens if, having access to more tests quicker would be good. And then this issue of the protective equipment, which we're facing all over the world, frankly. I have a colleague who was in the medical was a surgeon, and he said in his own former practice, they were having shortages of gowns before this ever happened. They were starting to delay access to some surgeries. And so there's been a shortage just before this. So now it's exacerbated. So I think it leads to some bigger issues in the Congress about supply chain vulnerabilities and reliabilities. We have in law a requirement that on medicines, the drug manufacturers have to report by law to the FDA if they see a disruption in the supply chain. The FDA announced yesterday there's one drug, they did not name it and they won't because they don't want to cause a run on it, where they're seeing that. I met with an executive vice president of one of the companies who said they still feel they have a bubble of supply, they're not feeling it yet. A lot of the base chemicals that are used to create generic drugs, that base chemical comes out of China. It's generally shipped to India, and that's where a lot of our drugs come from. India has the capability to produce its own base chemicals, so we think there is dual supply chain capability there. But when it comes to the masks and the gowns and things, a lot of those are manufactured in China, and they're obviously consuming them, and we're in a supply limitation right now. But as I said, if things get to a pandemic stage here, we do have emergency supplies stockpiled around the country of medicines and masks and things that can be utilized. But you don't want to do that unless you have to, so that they're there when you really need them.
With all due respect to all of you before us today, is the grand scheme scenario being underplayed to prevent public panic?
No, I don't know quite what you mean by that, but I think what we're trying to do is look at the facts of the matter and make sure we're prepared. You want to be prepared for the worst case and hope for the best case. We're not going to be Pollyannish about this, but we think we can learn from what's happening overseas and what's working, what's not. I mean, on these situations, the goal is to contain it wherever it breaks out and hope it never spreads. If you think about Ebola, we're still in an Ebola fight. You think about Zika, think about some of these diseases, we were either able to get them kind of back in a box and minimize their spread, or in this case, it got away and it's spreading now. And so that then changes how you cope with it through your public health system. Initially they were saying you would identify somebody that has it, you would identify everybody they've been around, and that's somewhere in a couple hundred people. And then you go to each of those and identify all those people and you're surveilling that. Well, once it begins to get away, that's impractical. You'd be surveilling everybody. So, okay, now what do you do? Well, now you go to this next step. And I think that's why you see things change. The person in Northern California who tested positive, there was some complaint about should have been tested earlier. At that point, though, that person didn't meet any of the known criteria. And so that's why there was this back and forth. Once they did test and find that person was positive, then CDC changed the criteria to say, okay, this thing has changed now. And now we have these cases in Oregon and Washington where it does not appear, at least initially, that it's related to travel and everything else we were seeing. So that just tells you it's beginning to show up. And it may rumble around here for years, who knows? Hopefully by then we have a vaccine and we have treatments. And I think I said earlier, the FDA is repurposing some drugs to see if they will help in a treatment modality, and hopefully seeing some success. We got time for one more? Anything else? Yeah.
The medical supply reserve, is that a federal program or just?
We do have that, yes, under Barda, and don't ask me what that stands for, but Barda, we set up a command structure to deal with situations like this, and Dr. Catlick oversees that. And then we have a whole system in place to have medicines available around the country in different stockpiles, so that if there is a shortage somewhere or a pandemic or any other kind of disaster, frankly, it has more to do with disasters. We have more of those than we thankfully do with pandemics. But do we have the supplies literally you could take out of a warehouse, put on an airplane, and drop somewhere? Now you have to cycle through those supplies to keep them fresh. I mean, so there's a lot to the program, but it is a federally based program. And then the federal government provides funding year in and year out to local community health organizations to be ready for pandemics and other ththings that have a national scope. That's why there's national funding involved. I think Oregon has gotten somewhere in the order of, in 2020 alone, Oregon received $7.67 million for local health preparedness activities. So this is an ongoing partnership, federal, state, but we know at the end of the day the people, the providers, the hands-on are here in our communities, and they do a fantastic job. And so it's a state, federal, local partnership. So thanks for coming out. Yeah.
Thank you.
Yep.
Thanks so much. Appreciate it.
Yeah, thank